It's UofL Today on 93.9 The Ville. Here's your host, Mark Hebert.
Welcome to UofL Today with Mark Hebert on 93.9 The Ville. Glad you're joining us for the next 30 minutes or so, where we'll be talking about some things going on at the University of Louisville, mainly some research and some health work, which you'll be interested in, at least I hope. This is the show about all things UofL, including research and students and programs and things going on campus. So I hope you'll stick around for the next 30 minutes, as I said. All right, so what have we got coming up today? Well, coming up in the second half of the show, the number of children who are abused in Kentucky will probably shock you. And you've likely heard about the problems with Kentucky's system for reporting, identifying, and punishing child abusers. Well, the UofL doctor who reviews fatal child abuse cases is going to be here talking about her job as well as what you can do to protect your kids. But first, there's some bad stuff around the world, and I'm not talking about terrorism. I'm talking about biological agents and deadly, uncurable viruses and diseases. Dr. Paul McKinney is an associate dean in the UofL School of Public Health and Information Sciences, who's been on the front lines of trying to battle outbreaks of these deadly infectious diseases that are killing thousands of people across the globe, and in some cases right here in the United States. Good to see you, Paul. How you doing?
Very good, thanks.
Yeah, you do a lot of bad stuff, don't you?
Well, we try to protect people from bad stuff, actually. So, yeah, but we have to be aware of the bad stuff in order to have the right kind of defensive techniques in place to make sure people stay healthy.
And the bad stuff we're going to talk about here in the next few minutes, just so you know, is like SARS, pandemic flu, Zika, some of those things. So we'll just give the audience a preview of what we're going to be talking about here. What is the one thing out there that you're working on right now is in terms of a grant or trying to stop these viruses from spreading? What are you working on right now?
So we're working on what's called a worker training program, is how it's officially known. It's a grant through the National Institute of Environmental Health Sciences, which is an NIH branch that's in the Research Triangle of North Carolina. And we're in a consortium arrangement with Emory University to provide training to healthcare personnel about all these infectious disease agents on the horizon that could present a problem at pretty short notice in the area, as Ebola did in the U.S. It sort of appeared without notice in Dallas, and it took everyone by surprise and changed the way people approach infectious diseases around the country.
And this program that you're talking about, is this just in the southeastern states, across the U.S.? Where are you working?
The grant program has a number of sites that are funded across the country, but in particular, there are 3 universities funded in the southeast that have different responsibilities. Duke University, University of Alabama, Birmingham, and Emory University are the 3 that are funded in that region. And the Emory group is looking specifically at emergency medical services personnel who might need to transport somebody with one of these conditions, and also people on the fringes that might otherwise be left out in the thinking. Public health personnel, people who work in airline services, screening passengers at airports and things like that. So we want to get everybody who might have unexpected contact and make sure that they're prepared for the next big thing.
Since you talked about Ebola, let's go there first. You mentioned what happened in Texas. I guess, was that last year? I guess it was last year.
This is 14, actually.
Okay. Oh, wow. Is it that long ago?
Yeah, 2014.
Wow. All right. So where are we now in terms of Ebola? Is it really a threat? It started in Africa, and that's where it kind of spread. Is it really a threat to the United States and to healthcare workers in the U.S. now or not?
It's not an immediate threat as we see it. Of course, Ebola tends to flare up in various areas of usually Africa first, in these conflagrations, just a sudden fire erupts and it's without warning, and it can really spread very rapidly. But we don't see anything right now that immediately concerns us. The West African outbreak has been contained, and there is fortunately now a very, very effective vaccine that appears to be on the horizon for licensure. It's been field tested in West Africa, and seems to be highly effective, and we hope it'll be available for the next time around, should there be one with Ebola. But that doesn't mean there won't be another Ebola variant, if you will.
But Ebola's kind of tamped down right now, though, right? For lack of a better term.
Exactly right. So that's not the thing that concerns us the most at this moment.
All right. We're talking with Dr. Paul McKinney from the School of Public Health and Information Sciences at the University of Louisville. And we're talking about these outbreaks of diseases and viruses that happen across the world, actually, and in some cases in the United States. SARS. I meant the email you sent me. Some things you wanted to talk about mentioned SARS. I thought SARS was gone. I haven't heard anything about SARS in years, and you mentioned it as the return of SARS. Is that really
SARS is a
coming
concern?
Back?
SARS is a concern because nobody knew exactly how it erupted in the first place. We kind of have some hints about where it came from, and certainly know how it's transmitted. But it, again, like Ebola, it kind of exploded on the scene very rapidly and then just went away. So we know that there's continued reservoir out there in nature. It could re-erupt without warning. We don't have a vaccine against SARS, as you know, or the related virus. They're called coronaviruses. There's another one called MERS, the Middle Eastern Respiratory Syndrome, as opposed to the severe acute respiratory syndrome, SARS. So either of those could make an appearance on our shores and would be a real problem since we don't have either an antiviral treatment for it or a vaccine to prevent it. So we have to have methods just to prevent human-to-human transmission and to keep people as safe as possible where they are.
Is there any, and explain to people, I guess, what SARS and MERS are, just a refresher course here.
Yeah, so they're viruses that attack the respiratory tract and basically cause severe pneumonias.
And they're transmitted by the air. I can get it if you cough on me or something.
That's right.
As people will recall, right?
That's the part that is most concerning, if you will.
Yeah,
I wanted to say scary, but I don't want to scare
scary.
people or alarm
Scary's
people.
the right
but
term.
There is a need for reasonable concern because person-to-person transmission did occur for SARS in North America. Fortunately for the U.S., it was not on our shores. It was in Canada. But, in Toronto, which is awfully close to our borders, they had a major problem there, hospital shutdowns, healthcare workers who were infected left and right in a particular setting there. So we don't want that to happen ever in the U.S.
And is there any sign at all that there's a rebirth of that, of those two viruses around the world?
Well, there's episodic cases of MERS, but SARS is not being seen in humans at the present time, so that's reassuring for the moment.
We're talking with Dr. Paul McKinney from the UofL School of Public Health and Information Sciences. Paul, what is the one thing that UofL and other folks are teaching healthcare workers about how to keep, SARS, MERS, Zika, all these things away from them when they don't know what kind of patient necessarily is walking into their hospital or their clinic?
So we're teaching them effective use of personal protective equipment. PPE is the abbreviation that's commonly used out there. When that is appropriate to use, under what conditions you should use it, making sure that you have equipment that appropriately fits, especially if you need to use what's called a respirator, which is a special type of mask that filters out infectious agents. When do you need to use gowns, gloves, protective shoe equipment, and things like that? Because anytime you get infectious material on your clothing, on a skin surface, then it's a recipe for transmission either to yourself or to other people. So the key is, when do you use that equipment? How do you safely put it on and take it off? More importantly, taking it off, because that's when exposure more often occurs. When is it unnecessary? And how you can use it when there is suspicion but not yet proof of a major infection, so you don't have to worry after the fact that you've been exposed.
You didn't want to use the term fear earlier in this interview, and I'm going to use it. Is there fear among healthcare workers about these diseases and infections that we don't have any cure for or any vaccine for? Is there a worry out there in the healthcare community, or are they just thinking, look, I got in this field and I'm going to run into stuff that I knew was going to be bad?
I think there's an undercurrent of angst, if you will, about those kind of things, but it really doesn't rise to the surface very often. It flares when we hear about an outbreak, when Ebola's on the news, and certainly the fear rose in a major way. I think that at the present time, it's a very minor level of concern, but there is still appropriate concern out there. And the issue is to make sure people don't lose track of the everyday and when things can approach them without warning, and make sure their defenses are up appropriately at all times.
We're in the middle of flu season right now. H1N1 a few years ago was the big flu and killed some people. Is there any growth of any flu out there that is really bad stuff that we're not prepared for in the U.S. right now?
Well, right now we're seeing primarily H3N2 virus, and it's affecting in quotes, the usual suspects, people who
Elderly.
people with immune system problems, the elderly, people who have not been immunized, people who have chronic diseases, and so forth. So the important thing is that people not forget they should be immunized annually, and that it's not too late, even this season, to get it. Don't wait any longer to be immunized if you haven't been. Go out and get the flu vaccine now. But the disease is in circulation. It'll be in the community probably for a period of time, a few weeks before it goes away. There are enough people who are suffering right now that you're going to get exposed sooner or later. Best to go ahead and get protected. This doesn't seem to be a killer flu, if you will, in terms of higher mortality than prior years. But even in a so-called usual year of flu activity, many people die, unfortunately. And our goal is to try to protect those people as much as possible.
Talking to Dr. Paul McKinney from the University of Louisville Public Health Department and Information Sciences, and we're talking about these viruses and bad stuff that's around the world. And the one that really just struck people, I think, last year, and the one that's really at the top of the list, and I probably buried the lead and I should have asked about it first, is Zika. That's the one I think that folks are most concerned about. Now, we're in the middle of winter right now. Mosquitoes aren't flying around, so what can we expect come springtime and next summer when mosquitoes are back in the air and presumably transmitting this virus?
Yeah, well, that's the concern, of course, in the areas of the country that have already experienced infection of the mosquito populations, namely certain areas of Miami, South Florida, and southern Texas along the Rio Grande border. That's where CDC and state health departments are going to be focusing activities to make sure that the populations don't rise up again, that is, the mosquito populations don't increase, that are actually carriers of the virus. We don't know if it is going to overwinter in certain areas of the country. That is, will it be able to survive in some form, and as new mosquitoes emerge over the spring, will they actually be infected with Zika or not? We don't know the answer to that, unfortunately, but believe me, the surveillance will be very heightened in those areas, and every attempt will be made to eradicate any reservoir that exists down there. Now, in Kentucky, of course, we don't have fortunately, any mosquitoes that are infected with the virus, but anytime a person returns to Kentucky, and we've had, of course, people who've traveled, come back with symptoms of Zika, that's a concern for a period of time. They can have the virus in their bloodstream. If mosquitoes were to bite them, it could be the source of ongoing transmission in local mosquito populations. So we're advising all those folks to use appropriate repellents when they return to the U.S. so mosquitoes don't bite them and therefore begin to transmit disease elsewhere.
So I'm heading down to Florida here, maybe to Fort Myers or someplace like that here, not going to Miami in the next few weeks. Should I need to take any precautions against mosquitoes and spray with DEET and all that stuff if I'm laying on the beach in Fort Myers?
Fort Myers, at this time of the year, I don't know of any problem with mosquitoes at all down there right now.
Well, how about people that are going to Miami? If Kentuckians or somebody's flying down to Miami for a week in February or something, should they be worried?
They should check immediately before they go, because with the winter weather warming so much in different places, the conditions being much milder, the mosquito population could reemerge earlier than it usually does. So it's hard to predict. I can't give you a particular date that would be safe and one that wouldn't be. But check with local authorities before you go about the mosquitoes, and if they have reemerged, then it would be then a good idea to use repellents at that time.
Final thoughts from a public health perspective on all these bad things around the world, Paul, just for the average folks in Louisville, Kentucky?
Well, the good news is that the level of preparation in general has increased a lot. Our efforts are out there to make sure that we're on the defensive constantly. We raise the concern to an appropriate level, not to the level of scare tactics by any means, and that we encourage at all times ongoing research in the areas of vaccine development and such that can keep us safe for the duration.
Very good. Dr. Paul McKinney, always good to see you.